and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I am very happy to see you all again. Apollo Hospitals has always been at the forefront in creating health awareness, and with our Facebook sessions, we have been bringing you a lot of information on diseases, path-breaking treatments, latest technologies, and medical innovations, so that you can prevent and tackle diseases that are hindering your good health. We are also delighted to bring you seasonal and trending information so that you're well armed with awareness at all times. As the temperature is dipping in many parts of the country, we must also know about the effect of cold weather on our health, and particularly on bones and joints and on arthritis. Arthritis means inflammation of a joint, and there are various types. The most common type is osteoarthritis, which involves degeneration of the cartilage that protects the bone ends within a joint. And there are also autoimmune types of arthritis where the body attacks its own joints and bones, and this leads to inflammation. So these are the different types of arthritis, and during the winter season, joint pains and muscle stiffness may be bothering people who already have arthritis. And there are many reasons or theories as to why this might happen. So today, we are looking to the doctor to explain to us how the winter affects the joints and bones and how to take measures to prevent or mitigate the effects of the cold on arthritis. To discuss this, I'm honored and delighted to welcome Dr. Professor Raju Vaishya, Professor and Senior Consultant, Orthopedics and Joint Replacement Surgery at Indraprastha Apollo Hospitals, New Delhi. Dr. Vaishya has the MBBS degree as a gold medalist from the Jivaji University, Gwalior, and then he completed his MS in orthopedics from the same institution, and then his MCH from the Liverpool University, England, FRCS and FACS as well. And he has been a world record holder listed in the LIMCA and in the India Book of Records 4 times for doing bilateral total knee replacement in the oldest person and a couple. He's also been featured in the Asia Book of Records twice for setting a record for writing the maximum articles during the COVID pandemic in a short time, publishing 40 articles and 106 papers in 2020. He's the author of almost 700 plus publications, which have been published in book chapters, international and national orthopedic journals and blogs. He's a pioneer in using 3D printing patient-specific instruments for TKR and cartilage transplantation in India, recipient of several distinguished awards like the Dr. B.C. Roy Award, Gold Medal of the Madhya Pradesh IMA, the Siemens Gapio Award, Distinguished Researcher Award of AHERF, and many more. He has also been awarded the Best Paper Publication Awards of the Delhi Orthopedic Association, Indian Arthroscopy Society, and the Apollo Group of Hospitals on many occasions. He's also been on the editorial board and is the editor-in-chief of the Journal of Orthopedics, Journal of Orthopedic Reports, and many more. Welcome, Professor, to this discussion today. Thank you so much for joining us. So let's begin by asking you, before we get into the seasonal aspects, if you can give us an overview on what exactly do we mean by the term arthritis?
Arthritis, as you rightly said, is a disease of the joint where inflammation takes place inside the joint. And if it persists for more than 3 to 4 weeks, we use the term arthritis in these cases, because simple joint pains usually should not last for more than 1 week. But if you have to take medicine, if it is disturbing you, and if it is persisting or increasing for more than 4 weeks, you have to think of arthritis. There are several types of arthritis that exist in the body, and more than 100 types of arthritis are known to us. And they may affect various types of joints. Mainly, the big joints of the body, like knee joint, hip joint, spine, and so on. But there are inflammatory arthritis where smaller joints of the body are commonly affected, like finger joints, joints of the feet, and so on. And there are certain type of arthritis like ankylosing spondylitis, where spine is more commonly affected than peripheral joint. So there are different types of patterns that are known to us, and it is very important that one should take an early consultation from a specialist if the pain is persisting, as I said, more than 3 to 4 weeks, rather than self-medicating himself, because treatment and outcomes may be much, much better if the treatment and if the diagnosis and treatment is initiated early rather than late.
So, what are the common symptoms of arthritis, doctor?
Arthritis usually presents with pain in that particular joint, either one joint, or there may be multiple joints involvement, like in rheumatoid arthritis. So pain in the joint, there may be swelling, and classical symptom of arthritis is stiffness of the joint that usually happens after rest, right? Like if you get up in the morning, you feel that joints are stiff. Once you move around a little bit, the joints open up. It's like an old car, where in winter it may have starting problems. So arthritic joints also have starting problem. Longer is the duration of stiffness, the more severe is the likelihood of arthritis or inflammation. Then there may be deformity in the joint, like bow leg deformity or knock knees, kyphosis in the spine, and so on. And there may be stiffness or restriction of the movement of that particular joint. So these are the common symptoms that arthritis presents with.
So, you mentioned that there are many, many types of arthritis, but what are the most commonest ones that people usually talk about when they say they have arthritis?
Right. The most common type of arthritis is osteoarthritis, where the degeneration of the cartilage happens in the joint, and it usually affects the big joints, weight-bearing joints like knee joint and hip joint. By cartilage, I mean the end capping of the bone, which is a soft structure which is very smooth and that gives frictionless movement in the joint. And if it gets damaged, the person will have pain, person may hear noises from the joint on bending that particular joint. So osteoarthritis is the commonest, and it is usually age-related and should happen after the age of 50 or 60. But we are seeing now more and more younger people getting affected by this problem, which is considered to be an age-related, but because of our poor lifestyle, obesity, improper food, and so on, we are seeing this condition particularly in younger population.
Right. So coming to our topic today, which is about the winter, why or is it even a fact that the cold weather affects those with arthritis? How does it affect the bones and joints at all?
COVID.
Not COVID, doctor. The cold weather, the winter.
I'm sorry. COVID also affects, by the way, joint. It may cause severe pain in the muscles and in the joints. But cold weather is certainly associated with increased severity and increased incidence of joint pains and arthritis, because cold weather increases pain sensitivity, it slows blood circulation in the limb. It may also cause muscle spasms, which is painful, and there are barometric changes that happen in the atmosphere, which puts extra pressure on the joint, and leads to increased inflammation and joint pains. So you are absolutely right. Arthritic patients in winter may have more problem than in the summer or hot weather.
So does this affect people with osteoarthritis alone, or people with any type of arthritis may have worsening of symptoms in the cold weather?
Usually the arthritis which has more inflammation, like inflammatory arthritis, for example, rheumatoid arthritis, ankylosing spondylitis, and so on, will have more pain during winter. Osteoarthritis patients will have lesser pain compared to inflammatory arthritis, but they will also experience more pain.
So what would you advise people to follow during the winter to mitigate their symptoms? How should they deal with it?
Well, as I said, because winter predisposes them to increased pain, one should stay warm, wear warm clothes, and especially in the periphery, like in hand gloves and proper socks, shoes. They should also make it a habit to get moving. The more you move, the chances of circulation in the joints are better, and you will have less pain and less stiffness. Then it is very important that one should try to stretch out their joints and body muscles so that there is less amount of spasm and pain which is related to arthritis. One should eat well during winter to protect their joint, because your healthy diet will give good nutrition to the bones and joints, and you may experience less pain. One should also try to have an optimal body weight, because obesity is directly related to arthritis. The more weight you put on the joints, the more likelihood of arthritis happening and getting worse are there. So one should try to keep body weight under control. And as I said before, do not self-medicate. If you have pain, you must consult a doctor and take timely treatment and advice.
There are a lot of myths that, there are certain foods that will aggravate the joint pain during winter. So is there anything that people should really avoid during this time? Any food to be avoided, or any particular drink to be avoided, or is that just a myth?
Yes. There are certain types of food which increases the chances of arthritis getting worse, and those should be avoided, like deep fried food, processed food, processed meat, for example, sugary drink, alcohol, and refined grains. Alcohol and sugary drinks, for example, may have more purine in them, and will increase the uric acid level in the body and may cause arthritis. So these are the foods that should be avoided. And also caffeine containing food may increase pain, because they increase inflammatory response in the joint.
What are the different types of exercises that one should do? Are there any specific exercises, or is it just walking and aerobic exercise? What about stretching, yoga, and all that?
Aerobic exercises are very important to give adequate oxygenation to the muscles and joint, and one should try do pranayama type of exercises every day. Then stretching, of course, is very important to keep your joints moving and avoid stiffness. They also help in increasing circulation. So then specific exercises related to the joint. You have problems like knee joint. For knee joint, quadriceps exercises are considered to be very good, uh, which is very simple to do. And if somebody has frozen shoulder or problem related to shoulder, then there are specific exercises which you can learn from your doctor or physiotherapist and can do it repeatedly at home on a regular basis.
Are there any exercises or any activities that should be avoided during the winter in these kind of patients?
As I mentioned, you should avoid the food that we have already discussed. Then you must have body weight under control, sugar under control, do regular exercises. Smoking is again not very good for bone and joint because that reduces the circulation, and one should try to quit smoking and use food that are rich in antioxidants like fruits, vegetable, beans, nuts, whole grain, seeds, and so on. These are good. Avoid carbohydrate and fatty foods and increase protein level unless you have a uric acid problem.
What is the role of good sleep in avoiding aches and pains, doctor?
Sleep is very relaxing. If one is blessed with good sleep, then joint pains may be quite under control because that relaxes the muscle, give rest to the joint. But before getting up in the morning, arthritics should do some simple exercise in bed before getting up, so they will find it easy to move around.
In case there is a joint pain and there's always this thing that people wonder whether to ice the joint or to keep it warm. So what would your advice be for arthritic patients? So if they have pain, is it a good idea to use a warm press or
That's a very good question. It's a simple thing. If you have any acute pain that has just erupted and it's very severe because of arthritis or injury as well, one should use ice because ice prevents the blood clot formation, it reduces the bleeding at the site, and it helps. But in chronic condition, patients having chronic arthritis, heat is better, especially the moist heat, because it diffuses into the joint, reduces inflammation, and also relaxes the muscles around the joint.
Is there a role for any vitamins and supplements which can help during this time, doctor?
Oh, of course. Vitamins and minerals are very important for the health of bones and joints. And on the top of their list is vitamin D. Vitamin D is the real tonic or for the bones and joints. And it has been found that despite, for example, in India, despite having sunshine throughout the year, we hardly consume sunshine during our daily life. And hence, about 70 to 80% of our population is suffering from vitamin D deficiency, which may not be apparent. But now it is possible to check vitamin D level by blood test, simple blood test, and one should try to do it, if not every year, at least, if not every 6 months, at least once in a year. And that can be supplemented with medicine or with your diet, through your diet by taking food that are rich in vitamin D, like milk and milk products, fish, egg, and there are other drinks that are available. And you must also expose your body to sun at least 5 days a week for 45 minutes. And it is a good habit if you can do that, because that will build up your vitamin D level that will protect the bone and decrease the joint pains. The other minerals and nutrients for bones and joints are calcium, then magnesium, vitamin K, and there are plenty of things that are available in our kitchen, for example, that we normally use are good for joints, like haldi or curcumin. There are many other things like green tea is considered to be good, and fish oil is considered to be good for joint. And one should try use all these natural food also.
So finally, I just wanted to ask you, doctor, what are the best ways to prevent arthritis from happening in the first place?
Prevention, of course, is better than cure, as you know. If you have a sitting job, try avoid sitting for long hours continuously. Try to take a break, improve your posture. That is also known as ergonomics, which is usually taught in all big corporate houses so that their staff do not suffer from bone and joint related problems. The most important thing is to keep your body weight under control, do regular exercises and stretching, avoid alcohol, avoid smoking as much as possible, avoid carbonated drinks that may have caffeine and cause increased joint pains, and use food that are rich in antioxidants, as I mentioned before, like fruits, raw vegetables, beans, nuts, seeds, and whole grain. And if you take all these, you can keep your joints moving and the life of the joint is increased.
Thank you so much, Professor Dr. Vaishya, for this wonderful discussion. So viewers, I do hope that you enjoyed this session and found it illuminating. So please take care, follow the preventive measures that have been discussed, and stay cozy and well during this winter month. Enjoy the season without anxiety. And if there is any severe discomfort, as doctor said, please do not ignore it. You can reach out to our orthopedic consultants across the country at any time. You can also reach out to us through our various digital social media channels and help. And we are always here to assist you both with your queries and with your appointments. Please also do subscribe to our YouTube channel for further updates and further health information. And do stay safe, do stay well. So till we see you the next time, thank you, goodbye, and namaste.
Thank you.